Chris Ward, and today I wanted to talk to you a little bit about the benefits of dental implants as it relates to the option versus dentures. Because dentures, there's 40 million people in the United States that wear dentures. That number, if you took the states of Texas, Oklahoma, Kansas, and Arkansas and combined all of that population in the U.S., that's pretty close to how many people in the U.S. are wearing dentures. So obviously, dentures can work for some people. It's basically a 3 millimeter thick piece of acrylic that's like a plastic that you put in your mouth that when the teeth are gone, it uses surface tension to try and hold in place for an upper. It goes right to the soft palate at the blow line so that there's a bead line that kind of creates some suction and tries to make it so that it stays up, and it can work really well from an aesthetic standpoint. The teeth can be in a good position. Smiling can look nice. When you talk about a lower denture, much more difficult. The tongue's in the way on the inside, the cheeks attach on the outside. So there's just a small rim for the lower denture to fit on. Well, there's less surface tension. It's much more mobile. You're trying to have your tongue and your cheeks holding in place while you eat or talk. A lot more challenging. I have patients with a lot more problems with lower dentures than I do uppers. The other challenge with dentures is that you're going to have bone loss over time. It's not like you take the teeth out and the bone are going to stay that way forever. I hear lots of patients that come in with existing dentures they've had for 20 years, and they're like, the first set of dentures I had made worked great, looked great, never had any problems with it. Well, 5 years later, it didn't fit as well. I had a new set made. They weren't quite as good. And then, another 5 years later, I had another set made, and they just still don't fit as well, and each one's worse. And I think my first dentist was my best dentist. Well, if you look at it, it's really the changing of the bone as much as it is what dentists did it typically. So as you lose bone, there's less architecture for the dentures to physically hold on to. So the retention gets worse over time. So when you go to dentures, one of the biggest disadvantages is you're going to have continual bone loss. Some of the uppers, problems with the gagging, the tasting, you don't taste foods as well. The textures, you don't get to feel as much. So there's some disadvantages to dentures, but obviously millions of people use them. It's just kind of who can tolerate that. And in my experience, there's about half to 2/3 that adapt to them in a way that they just choose to function that way. The other third, they cannot handle it. They'd rather go without, eat without. They just don't want them. So when we talk about dental implants, the nice thing about that is we can take teeth where we place implants in the bone, and we can support the teeth in their natural position with roots, like roots, the implants, so that when they're attached, they don't come in and out. We don't cover the palate. It's very, very thin in terms of where it touches the gum tissue. It's very easy to clean. It's something that for the long-term standpoint, the biggest advantage is you're not going to lose bone because the implants stimulate bone. So now we're stimulating that bone. That doesn't change. So the architecture that's the foundation for these implants and teeth stay in place. So this can be an absolute long lifetime procedure if you take care of them and maintain them well and do good compliance like we ask you to do. So it's a major advantage from just size, feel. You can eat and chew the things that we want. There really aren't any limitations. There's different materials. Some of the materials aren't quite as strong when we talk about the teeth that we make. There's different costs associated with different types of materials. So that's why what I really want patients to do is come in and let's talk about what are your goals? What is it? I really just don't want to be gagged anymore. I don't want this thing coming in and out. And so there's different price points based on different procedures and different materials that we use. So we can talk through all of that. But at the end of the day, dental implants can get you back to how you used to function and chew and eat. Smile, laugh. You don't worry about them coming out. And it's back to the lifestyle that you once had or that you've never had that you've always wanted. So major advantages with the implants. I hope this video helps you. Any other questions? I know there's so much to talk about on this. Please give us a call, 918-906-2525, or go to dentalimplantcenterofoklahoma.com and request a free consultation. We'll get back with you and schedule that appointment. I can go specifically in detail with you with the three-dimensional image exactly what it is that you're wanting. How can we do it? Are you a candidate? What are the procedures required to get you to that point? So hope this helps. Thank you.